Good afternoon. My name's Mark Brandreth. I used to be the Chief Executive at the Robert Jones and Agnes Hunt Orthopaedic Hospital in Oswestry. I did that for about 5.5 years, and I've changed jobs just in the last 2 weeks. I'm now the Interim Accountable Officer for Shropshire, Telford and Wrekin CCG and the Lead Executive for the development of the Integrated Care System. Thank you very much for inviting me to speak. I'm sorry I'm not with you at the moment in person. Toby asked me to just spend a few minutes talking with you about leadership in secondary care. I'm going to try and just touch on a few thoughts around that. In preparing for this, much of it is personal reflections on my own leadership journey and some of the things that I hold dear. I'll try and apply them particularly to a secondary care setting, but I also thought it may be helpful if I share with you my COVID experience. I'm sure you've had yours, and just talk to you a little bit about the work that I did on the Nightingale Hospital programme, where I was the lead director for NHS England for a few months, driving, delivering and making sure that we got those hospitals built. So a little bit more about that in a moment. So apologies, I'm on my own. I'm driving my own technology, so if it was a bit clunky, then do bear with me. Hopefully we'll get through this together. So if I start just by telling you a little bit about me, as I say, my name is Mark Brandreth. I've been in the NHS since 1993. I started my leadership journey at Bolton Hospitals. After university, I actually became a personal assistant to one of the managers at the hospital. Did that for about 4 or 5 years, worked in medical records and so on, and then really started on the kind of the very lower rungs of managing a service, and then gradually moving on from Bolton into Salford and Liverpool and other places, working both in community services, in commissioning, in secondary care, primary care, and also a short stint, 18 months or so, at the Department of Health. So I've moved around quite a bit, which is one of the things just worth reflecting on really in terms of what happens with NHS managers. We are almost forced to move around, much in the way that junior doctors move around in order to get different experience. It's almost the same for us, but without the designated programme organisation, we almost have to do it ourselves, really, which is kind of what drives, often a feeling of churn, really, particularly at senior levels. But latterly 5.5 years at Robert Jones has really allowed me to try and change and improve an organisation. A little bit more about that in a couple of minutes. So I just thought I would start by telling you about a little bit more about the hospital that I was managing. So Robert Jones is a specialist elective orthopaedic hospital based in the beautiful Shropshire. It's one of 5 specialist orthopaedic hospitals in the country, and it really is a world-renowned centre of excellence. When I took it over back in 2016, it was in trouble. It had gone into what was called breach of licence by the regulator, really around 2 issues. So a problem around data and the oversight of data. But actually what was discovered as part of that, which was a problem with the culture. And basically what had happened was there was some issues with some of the numbers, and the senior leader at the time had suppressed the publication of those numbers and the sharing of them. That brought all kinds of issues out in terms of the way that the organisation works and behaved. It's a consultant delivered service at Robert Jones. So it's very senior doctors, experts across the world in what they do, and you may well have heard of the hospital. But actually it was in really quite a bad state in 2016, in breach of licence, problems with the CQC, and actually beginning to lose its connection, particularly with its staff and with its patients. So over the last 5 years, we've gone on a journey of working through how to deal with that and how to address that. And for me, it absolutely starts with culture and the kind of place that the hospital is to work in. Unlike many other places I've worked in before, it very definitely has a family feel to it. There is mum there's grandma, mum and daughter in some bits of the hospital. The whole family is working there. And it's should be very locally connected to its community, and it certainly is now. So there's a certain stability that comes with that. The issues, of course, being with stability that sometimes it can be difficult to change and improve in terms of what needs to happen. So my previous post holder very much lived in her office. She wasn't particularly known to the staff, and she certainly wasn't very well known to the consultants. And I spent certainly the first 12, 18 months very definitely out in departments, on wards, in theatres, talking with the staff, talking with the cleaners and the porters and the nurses and others, to really understand the hospital and try to get underneath it. And I suppose that's my first message today, which is how do you demonstrate your visible leadership? How is that done? I think it's a really important facet now of any general management responsibility, and actually anybody in a supervisory level, being able to understand enough about somebody's job, arguably to live in their shoes, is a really important piece in terms of credibility. And I'd encourage you to really think about the leaders and the managers that have impacted on your career so far, and what it's been about them that's made that difference. And I think certainly for me, senior managers that have been visible, thoughtful, interested, knowing somebody's birthday, knowing that somebody's relatives died, knowing that somebody's children have just restarted school, asking those questions, checking in on people. More about that later as a theme. Really important contribution, I think, that general managers, senior leaders can play to driving and improving an organisation. The other thing that I did was invested heavily in some leadership development programs. We developed a program called Releasing Potential that took a mixture of staff from across the organisation, and over 9 months gave them an action learning type approach to improvement and working together, and really trying to bind the organisation together. So my kind of second reflection is about the cross-working between departments, between teams. And I think this is something that's really actually changed over COVID. I'm going to give some examples in a minute. But previously, I think we tried to work really hard to enshrine some of that working, so that perhaps people, even though they'd worked in the same hospital for a very long time, people who didn't know each other actually got to know each other, worked together on a project or a piece of work. And really that programme was absolutely seminal in our work. And then latterly, that emerged and developed into the work that Toby and Ian did around a programme called Serving to Lead, which we did in conjunction with them. And so I won't say more about that now, but just to say again, similar thinking mindset behind that programme, which was very much about action learning, a coaching style of learning, rather than in effect chalk and talk, which is very kind of old fashioned now in terms of the way of delivering programs, but immersing people in an experience, getting them to work together. Again, really, Serving to Lead's been another really important program in the development of the hospital. So what was the outcome of all of that? Well, we got off our breach of license within 12 months. And Robert Jones now has the highest patient satisfaction scores, the highest patient satisfaction scores in the country of all NHS hospitals, which is an incredible achievement. And people often ask me how I've done that, and I say the answer is really simple. There's a phrase that's well known: happy staff, happy patients. Happy staff, happy patients. We took 3 responsibilities at Robert Jones: caring for staff, caring for patients, caring for finances. And I used to say to staff at induction, my job as chief executive wasn't actually caring for patients. That's what they do. My job as the chief executive was caring for them and looking after them, making sure they had what they needed, making sure that they could thrive in the environment. And so alongside our best in class patient experience scores, I'm also very proud to say that Robert Jones also has the best in class staff experience scores. And I firmly believe happy staff, happy patients, that those 2 things firmly go together. So again, if you're thinking about your leadership journey, thinking about where to start, thinking about how to improve the service that you provide or how to improve the area that you're responsible for, I think there's nothing better than starting with the staff. It's a very obvious place to go. So I'm going to take that theme a little now and just move into some of my COVID experience. I've got a small number of photographs to share with you, just to illustrate some of what we experienced. So, like many of you, a different experience during COVID, in that I was asked by Amanda Pritchard, Simon Stevens at NHS England, if I would drop everything and go into NHS England and help. There were 4 chief executives from across the NHS that did the same. I was asked to pick up the Nightingale Hospital programme, and the brief actually was very simple. If you remember, at the time we were seeing bodies from Italy in particular. I remember it on Sky News in the office, wrapped up bodies, people being airlifted out. We also saw people being treated, on hospital floors and in other building floors across Europe. And of course, we were very frightened that that kind of thing was going to happen to us and happen to the NHS. The planning assumption at the time was we were going to be totally overwhelmed. So the brief was to build 12,000 hospital beds right across the country. So we ended up doing that across 7 sites, and basically we were given 3 weeks to do it, which is a ridiculous, when I think about it now, is a ridiculous ask. I'm very pleased to say that we, working incredibly hard, a whole fantastic team, that we managed to do that. There's some politicking around the amount of money that was spent, what was done, whether we needed them all. What I can tell you is there were patients treated in many of the Nightingale hospitals, and without them, we wouldn't have managed to cope, particularly through that first peak and arguably through the second. What it also did was it bought the NHS some time. It was an insurance policy and allowed the NHS, as an example in London, to build a whole floor of critical care beds and to staff them while we were building the Nightingale. So, or as a consequence of us building the Nightingale. So, very proud of the achievement that we did. The thing that for me was an absolute pleasure was working hand in glove with military colleagues, and so. Before I come on to that, let me just show you a few pictures. So this is an example. This is actually the Exeter Nightingale, which was an old home base unit. I mean, just look at that facility. It looks like an NHS hospital. This was the last of the 7 that we did. We even managed to put a ceiling in it, which was amazing. But if you look at that, doesn't that just look like an NHS hospital? A totally temporary facility built incredibly quickly by colleagues from across the country, and a really amazing achievement. And then, as an example, just to show you the Manchester Nightingale Hospital, which took patients right through the pandemic, and as a really good example, I was in there last week at an awards dinner. It's back to being a conference centre again, a Grade 1 listed building with all of the issues that you can imagine that we had, putting in a hospital environment with miles, 7, 8, 9, 10 miles of copper piping, so that we could care for patients in the way that we needed to. So again, a great, incredible achievement. The great privilege for me was working absolutely hand in glove with military colleagues. You can see on the right of this picture somebody incredibly important. And I don't mean the gentleman leaning on the lockers that I know you will know, but I mean to the right of him, as she was then Colonel, now Brigadier Alison McCourt. Alison and I worked incredibly closely on the Nightingale programme, really hand in glove in terms of working together, and it was a real privilege to both learn from and work with senior military colleagues in the planning and the execution of the Nightingales. So trying to build hospitals that have got computer systems in 3 weeks that are going to be safe, that are going to be secure, that are going to have the equipment that they need. The NHS didn't have 14,000 spare hospital beds. Signing an order, seeing them brought in from Turkey, the equipment that was coming from all over the world, really incredible stuff. So it was a real privilege to do that. Now, you'll know this about working with military colleagues in terms of how things work. And so if I just give you an example, one of our very late evenings in the office, a whole mountain of curry being consumed, I guess just wanted to make the point that even in these very dark days, even when we were working 16, 18, 20-hour days, 7 days a week as a routine, we really did try to look after each other. I remember the time actually, although being very serious and a very serious issue, with an awful lot of humour and leg pulling, often me with military colleagues, you won't be surprised to know, and people working incredibly hard, but often with a smile on their face. I just wanted to just kind of touch on, I suppose, what I learned briefly from that experience. And I can't find the source for this slide, unfortunately, but I've included it because I think it's really helpful. There's almost these three stages that I think people were going through, and I can kind of reconcile and appreciate this. That first part of kind of how it was, the whole fear zone thing, the hoarding, the fear, really. I mean, I certainly met two of my colleagues back at the hospital when I had the privilege of telling them about the pandemic, that it was going to happen and this is how it's going to work. I mean, I absolutely broke down in tears and totally frightened about how it was going to be, and a very difficult message and a very difficult time watching people, including me, go through that kind of whole fear thing. I guess this second one, this kind of learning thing, the learning zone, and particularly the one that resonates with me here is I start letting go of things that are out of my control. And I think I thought really deeply about the way of running the National Nightingale programme. And it was really obvious to me very quickly that we didn't have the time to do the normal kind of programme and project planning that we would do in intense detail. We were literally learning by doing each day, trying to move things on, trying to make sure we were looking one step ahead. There was a plan, but blimey, we were living on our experience and wit and nerves. And the thing that I learned more than anything in that was to trust. What I did know was, and even though I might not have known their names at the time or what their experience was, I knew that I'd been surrounded, both military and civilian, including NHS, with some of the best people that the country had to work on this. And so trusting people to get on, making sure that they've got the support, and then checking in with them was very definitely something that I learned to do. And I just offer a reflection back to my first period at Robert Jones, where, of course, the looking back, in order to grind us out of the problems we were having, there was an awful lot of kind of micro control in terms of what was being done. That would just not work with the Nightingale programme. We had 7 teams in regions and in trusts right across the country working on this programme, as well as the national team. And so actually getting the right people, trusting them to get on with it, was actually the only way to cope. And that's very definitely what we tried to do. Just moving then into the growth zone, again, the other one that resonates with me here, I show gratefulness. So we try to find every day reasons to celebrate, reasons to be cheerful. We were all away from our families and the things that we loved. We were all working 7 days a week, making those adaptations. But even within that work community, making sure that we looked after each other, again, really, really important part. And I guess, the one that shines out for me there is I show empathy to myself and others. And so actually being very open and honest with the team and with others about what it was like, sharing the fact that today had been the day that I'd had the little cry, or just had to go and have a little walk for a few minutes just to recompute actually what we were being asked to do and how we were dealing with it, and watching everybody go through those moments, however they did it, and just acknowledging that, and just sitting alongside people, perhaps quietly, and just being with them as we work through some of that stuff. So I like. Hopefully you found that. Happy to share these as well. Hope you find that slide useful. I just thought it was an interesting reflection. We worked really hard. I've mentioned the fun. I mean, it's a privilege to have gone on both Wildcat helicopters and a Chinook, but we had to get around the country. And so when you ask a military colleague if they can arrange transport, you never quite know what's going to arrive. And that was certainly quite an interesting day. Just moving on then a little bit, I really like this Douglas Reddy slide, kind of, pulling some of that together, I guess. I think that leadership is changing. I think there are two parts to that. I think the leadership in terms of its requirements, its core requirements, is changing. And a bit more about this slide in a second. But I also think we're very definitely moving on now, particularly in secondary care, but actually right across the NHS, into a place where we're being asked to work as systems rather than individual organisations. And again, let's just reflect for a minute. Most hospital chief execs up and down the country have been brought up in an incredibly competitive environment where they are, yes, one NHS, but in reality working in competition with their colleagues for resources from neighbouring hospitals. And I can tell you at the moment that the NHS has changed and is changing dramatically over that. The sense of people supporting and helping and working in a mutual way, particularly around systems, is really palpable. And I think it's really interesting that that's changed, and more about that in a second. So I really like this Douglas Reddy slide about the top 10 list of leadership requirements for the future. The number one here about change mastery, we have to be experts in managing change, and that responsibility that we want every one of our employees to have to do things faster, better and cheaper, I think is a really important thing that I continue to push in the organisations that I lead. And then just to call a couple of others out, the smart innovation. Failing fast, there was an awful lot of failing fast with the Nightingale programme. We used to huddle, at the start we were huddling 5 times a day, and within an hour and a half if we tried something, and that was the pace in which we would work, if we tried something and it hadn't worked, we would just try something else. Yes, learn from it, absolutely, really important. But I think there is a change going on, and I certainly think in terms of the future, that narrative about failing fast and learning, I think, is really, really important. Number 4, the power of analytics and design. I think BI is a huge thing. I don't think we still understand enough about its capability, and so I'd really encourage you to think about your access to intelligence and information, and how that's developed, and the prediction of that, which is interesting. It's the predictive analysis that we're really, really keen to understand about. And then I guess finally on this slide, and I could go through each of them, but just number 7, authenticity, knowing yourself, being yourself, and bringing that person to work each day. I'm not actually really an NHS chief executive. In the eyes of my kids, I'm dad, I'm a taxi driver, I'm a cash generator, as well as, of course, I'm a son, and I'm a basketball coach and a Man City fan and a singer, and a partner and an NHS chief executive. And I just make that point about what goes on in terms of our whole self and how we bring that to our work, I think is really, really important. And again, to get the best out of me, knowing me, walking in my shoes, as I've described earlier, really important. Last couple of slides to finish with then. I think I've learned a lot about this over the pandemic, and I'm sure you have too. It is no longer shameful to not talk about how you look after yourself. And I don't just mean mental health, incredibly important, but I mean in the round. Are you looking after your physical self, your intellectual self, your social, emotional, occupational and financial self? I've interestingly, over the course of the pandemic, right in the middle of everything else, I decided to kind of restructure my personal finances. I was fascinated to see that on the screen. And when I've reflected on that, actually quite a lot of that was about what I could control and what I couldn't control. And interestingly, the pandemic back in kind of April, May, June 20, it felt like a moment just to kind of try and get myself organised and get my affairs organised, really. So interesting that actually helped me, as much of the other stuff has done too. But I just offer that to you as an interesting slide for reflection. And then just 2 slides to finish. So my key message today is that secondary care, leadership in secondary care is not really a leadership thing anymore. The whole world now is focused on systems and system working, and any chief executive running any hospital is expected to be part of a team of chief executives running a local area, a local healthcare system. How do we do that? What are systems all about? Really easy. It's all about relationships. The whole thing is about relationships. The management of the pandemic, from a Nightingale perspective certainly, and from the wider NHS, has all been about relationships and supporting each other and working together and understanding about how we do that. And again, I think this is the single biggest change in my leadership journey, is to understand that it starts with the relationships. If you're going to work with somebody and you can't trust each other, or you don't trust each other, it's just never going to work, however technically brilliant it is. And I think that's been a real change. And then finally, you'll be aware of this book. It's a fantastic book, but this is one of my favourite. Along with Kate said them all, friendship is one of the sweetest things, and I'm very proud to say that I've got a number of colleagues who've become friends over the pandemic, and people that I've shared incredible experiences with, that I'm very proud to know. So enough from me. I hope that was useful and helpful. Thank you for listening.